morning, folks. Ron Ray here with Turning 65 Solutions. This morning, we're going to answer a question that we've been getting lately. It is now October 24th, 2023, and the new Medicare numbers are out, and everybody wants to know, what is my Plan G going to cost me next year? And that's a very good question. We're going to answer it right now, and we go directly to the source, Medicare.gov, and specifically this publication right here called Choosing Medigap Plan 2023. Now, they're always a bit late on updating this one, so usually the newest version of this comes out around June or July, but nothing in here has really changed from last year to this year, except for a couple of deductibles and things that we'll point out. So we're going to skip right down to page 11 where this handy dandy chart is, where we can compare Medigap policies. All right, and what we're going to be looking at today is Plan G, specifically the standard Plan G, not the STAR, the high deductible Plan G. We're going to cover that in another video very soon to come in the next week or so. But a standard Plan G, not STAR. Now, Plan G, remember, is a Medicare supplement. It's a Medigap. It's secondary to original Medicare A and B. So original Medicare A and B pays first. They pay roughly about 80% of the bill. And then your Plan G pays your 20% that's left over, okay? There's one thing that Medigap Plan G doesn't cover, and that is that Part B deductible. You can see right here, and this is what changed, right? Nothing else changed. It still pays 100% of all your hospitalization. That's all that Part A coinsurance, Part A deductible, hospice, everything in the hospital, including skilled nursing facility care, first 3 pints of blood. It pays 100% of that. It pays Medicare Part B coinsurance. That's that 20%. It pays the Part B excess charge. That's an extra 15%. We've talked about that before, but basically what that is you owe 20%, and then there's a handful of doctors who are referred to as non-participating providers. In other words, they do not accept Medicare assignment. They accept Medicare, but they don't accept Medicare assignment. That means that they take the 20% from you, and then they're allowed to bill you an additional 15%. Now, there's only a few doctors that do that, and you can always hopefully know if you just ask first. Okay, but nevertheless, it doesn't matter with a Plan G because the Plan G pays that 15% for you. The only thing a Plan G doesn't pay right here, I don't think I can highlight it, is that Part B deductible. So that's the only blank you see. And that deductible, that's what changed. So this year, 2023, it was $226. So if you have original Medicare and a Plan G, your only out-of-pocket expense for hospital and medical insurance was $226 for the year. Folks, that usually covers your first office visit for the year, especially if they're doing blood work. So you go your first office visit, you get that done in January, you pay your $226 out of pocket, and then you're done for the rest of the year. You have absolutely zero out of pocket, okay, for medical and hospital. That's what changed. $226 this year, 2023. Next year, 2024, it's going up $14 to $240. Now that's it's not an insignificant increase, but it's a little bit less than I personally expected. I expected them to come in right around $250, but they came in at $240, so that's good. You got about a 3.2% increase in your Social Security check. Medicare premium went up just under $10 from $164.90 to $170.70. And so there we go. That's what changed on a Plan G. The deductible went up from $226 in 2023 to $240 in 2024. Now, your Plan G premiums, the premiums that you pay to the insurance company, are likely going up as well. Now, I don't know how much that's going to be because there's some different things that factor into that. What company are you with? What area of the country or even your state are you in? How old are you? What's your tobacco status? All of those things and a few other go in to factor how much those premiums are going up. we have kind of a rule of thumb here at Turning 65 Solutions. It says if your premiums ever go up more than 10% in any one year, it's time to go shopping. And if you can save at least $20 a month, then it's probably worth your time to go ahead and go through the underwriting process, which isn't hard. We just ask you a handful of questions, 12 to 15 health questions, and they're looking for big things. They're not nitpicking little things. They're looking for big things, and they either take you or they don't. But it takes about 15 minutes to go through that process and see if we can qualify you for a new Plan G with the identical coverage, same identical benefits, just with a lower premium. So give us a call if you have any questions or want to try to lower your rates. We usually find we can lower your rates by at least $20 a month, $240 to $300 a year. But in fact, if you've had your Plan G, or maybe you even have an older Plan F and you want to switch to a Plan G to save even more money, it's not unusual that we're saving folks $70, $80, $100, $110 a month on their annual on their premiums for their Medicare supplements. So give us a call. The number's 830-217-6711. Our expert agents are here. It doesn't cost you a penny to apply. And if you qualify and you save the money, if you don't qualify, you haven't lost anything but about 15 or 20 minutes of your time. That's what we do. We help people every day, and we're here for you. So give us a call, 830-217-6711, or check us out on the web at www.t65s.com. Folks, if you enjoyed this video, if you found the information helpful, please give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same information that you were today. Also, don't forget to subscribe to the channel so that you can be notified when we upload a new helpful video. We're going to be updating all the Medicare supplements here in the next couple of weeks as we get time. We're in the middle of the annual enrollment period, so we're real busy helping people, and I try to find time to make videos when I can. But we're going to be updating the Plan F. The Plan N is another very popular plan. We'll be talking about that one next. And then the high deductible F, the high deductible G, and the K, L, and M. Those all have out-of-pocket shares that have all changed, and we're going to be updating those. So watch out for the videos. Subscribe to the channel. Click the little bell so that you can be notified when I upload those videos and you can get that information. But if you just can't wait, give us a call, 830-217-6711. And we'll get you fixed up. Folks, we hope you enjoyed it. We hope you have a great day. Until next time, bye.